Hey everyone, welcome back to the channel. Today we're diving deep into two very important drugs in pharmacology, mannitol and acetazolamide. These two may sound complicated, but by the end of this video, you'll remember their classification, mechanism, uses, side effects, contraindications, precautions, and even their doses. All super easy. Let's go. Mannitol. All right, first up, mannitol. So what exactly is mannitol? It belongs to the class of osmotic diuretics. Now, osmotic simply means it works by pulling water with it. Imagine pouring salt on cucumber slices. Water comes out, right? Mannitol does the same thing inside our body. When you inject mannitol into the blood, it increases plasma osmolarity. In simple words, the blood becomes concentrated, so water from the brain and eye tissues starts moving into the blood. Then, when mannitol gets filtered in the kidney, it doesn't get reabsorbed. This means water and electrolytes like sodium and potassium follow it into the urine. So, net effect, it reduces brain swelling, lowers intraocular pressure, and increases urine output. Uses. Mannitol is a lifesaver in emergencies. Raised intracranial pressure or cerebral edema, acute glaucoma attack, preventing acute renal failure, and even flushing out toxins in poisoning cases. Side effects. But remember, mannitol isn't harmless. Side effects can be serious. Headache, nausea, vomiting, dehydration, electrolyte imbalances, and the most dangerous one, pulmonary edema, especially if the patient already has heart problems. Contraindications. So when should you not use it? If the patient has severe kidney failure and urea, if they have pulmonary edema or congestive heart failure, or active brain bleeding except in surgery situations. Precautions and dose. Always monitor fluid balance in electrolytes, keep a close eye on serum osmolarity. For dose, it's usually given IV, 0.25 to 2 grams per kg as a 5 to 25% solution every 6 to 8 hours, depending on the condition. Mnemonic. Quick memory trick. Mannitol pulls water out of the man's mind. Think brain swelling. Now, let's move on to acetazolamide. This drug is from the class of carbonic anhydrase inhibitors. Sounds big, right? Let me break it down. In the kidney's proximal tubule, there's an enzyme called carbonic anhydrase. Its job is to help reabsorb bicarbonate. Acetazolamide blocks this enzyme, so bicarbonate is lost in urine. Result: urine becomes alkaline, and the body develops a mild metabolic acidosis. In the eye, the same enzyme is present. Blocking it reduces aqueous humor production, which lowers eye pressure. That's why this drug is so useful in glaucoma. Uses of acetazolamide. So, where do we use it? First, in glaucoma. Second, to prevent acute mountain sickness. Yes, climbers use this. Third, as an adjunct in epilepsy. Fourth, in metabolic alkalosis. And sometimes in edema, though not commonly now. Side effects. But here's the catch. Acetazolamide can cause metabolic acidosis, low potassium, tingling sensations in fingers and toes, paresthesias, kidney stones, and since it's a sulfonamide derivative, it can also trigger allergic reactions. Contraindications. So avoid this drug if the patient has severe liver disease, severe renal disease, electrolyte imbalances like hyponatremia or hypokalemia, or sulfonamide allergy. Precautions and dose. Always monitor electrolytes and acid-base status. Avoid during pregnancy unless really necessary. Dose-wise, for altitude sickness prevention, 125 milligrams twice daily. For glaucoma or seizures, usually 250 milligrams 1 to 4 times a day, sometimes IV 500 milligrams in acute cases. Mnemonic. Easy memory tip. Acetazolamide, acid. It causes metabolic acidosis. Quick recap. So to wrap up, mannitol, osmotic diuretic, pulls water out fast. Think brain edema and glaucoma emergency. Acetazolamide, carbonic anhydrase inhibitor, causes bicarbonate loss. Think glaucoma, mountain sickness, and metabolic alkalosis. One pulls water, the other pushes out bicarbonate. Simple. If this breakdown helps you, don't forget to hit like, subscribe, and share this video with your friends. Drop a comment below if you want me to cover other diuretics like furosemide or hydrochlorothiazide in the same style. See you in the next video.